All right, let's talk about something that affects millions of people but is, often kept behind closed doors. It's a condition that can seriously mess with your quality of life, and a big part of the problem is that its causes are so misunderstood. So today, we're going to put on our detective hats and solve the medical mystery of defecation disorder syndrome.
Okay, so here's our plan of attack. We're going to break this whole investigation down into 5 clear steps. First, we'll figure out what DDS even is. Then, we'll gather the clues, the symptoms, and red flags. After that, we'll identify our 2 main suspects, find out how doctors actually crack the case, and finally, look at the resolution, the treatment. Ready? Let's go.
So, first things first, what exactly are we dealing with here? What is defecation disorder syndrome?
Okay, the first crucial thing to get is that DDS isn't one single disease. It's more of an umbrella term, a clinical syndrome. It covers a whole bunch of different disorders that all have one thing in common. They make it incredibly difficult to have a bowel movement. And this isn't just some small annoyance. We're talking about something that can genuinely disrupt a person's entire life.
Every good investigation has to start by gathering clues. And in our case, the clues are the symptoms. These are the signs that tell us, hey, something isn't right, and they start to point us in the right direction. So what are we looking for? Well, the main clues for DDS are pretty specific. We're talking about consistent straining, that really nagging feeling that you're just not fully done, a sense of a physical blockage down there, and sometimes even needing to manually help the process along. When you see these signs popping up together, it creates a pretty clear pattern that points right at DDS.
Now pay attention, because while those other symptoms are clues, these are alarm bells. Doctors literally call them red flags. If any of these show up, the whole investigation changes. Things like blood in the stool, losing weight for no reason, or a fever. These aren't typical for a simple functional problem. They signal that we need to look for something much more serious, right away.
I know it might look a little, unusual, but this chart is one of the most brilliant tools in medicine. Why? Because it takes something that's really subjective, like a patient saying, "my stool is hard," and turns it into objective, standardized data. It's genius. It gives patients and doctors a common language so they can actually track what's going on and see if treatments are making a difference.
All right, we've got our clues. Now it's time to bring in the usual suspects. When it comes to what's causing DDS, it almost always boils down to one of 2 very different culprits, a functional problem or a structural one.
And honestly, the best way to think about this is like you're troubleshooting a computer. Is it a software problem or a hardware problem? A functional cause is like a software bug. All the physical parts are there, they look fine, but the programming that tells the muscles what to do is all messed up. A structural cause, though, that's a hardware problem. A physical part is literally broken, blocked, or not where it's supposed to be.
So let's zoom in on our main software suspect, dyssynergic defecation. This one is a huge player, affecting about 40% of people with chronic constipation. Think of it like a major coordination glitch. To go to the bathroom, your body is supposed to push with some muscles and relax others. With dyssynergia, the body gets its signals totally crossed. It tightens the very muscles that are supposed to relax. It's like hitting the gas and the brake at the exact same time. Nothing's physically in the way. The body is just fighting itself.
Now, over on the hardware side, we've got actual physical blockages. A rectocele, for instance, is where the wall of the rectum bulges out, creating this little pocket where stool can get trapped. Or you can have an internal prolapse, where the rectum literally telescopes down into itself. That's a real mechanical blockage. These are problems with the body's actual nuts and bolts.
Okay, so we've got 2 totally different suspects, a software glitch and a hardware failure. How in the world do doctors figure out which one is the true culprit? Well, this is where the detective work gets really cool.
The whole process follows this really logical path. You start broad, right? With a super detailed history and a physical exam. Then you narrow it down, using things like a colonoscopy to make sure none of those red flag diseases are in play. And if all of that comes back clear, but the problem is still there, that's when they bring out the big guns, the specialized tests designed to catch either the software bug or the hardware failure.
And this is that specialist toolkit. Anorectal manometry is the perfect tool for catching that software bug. It directly measures muscle pressure and coordination to see if they're fighting each other. But for a hardware problem, you gotta see it, right? That's where defography, or a dynamic MRI, comes in. This is the golden standard. It is literally a live-action video of the whole process,
so doctors can spot a physical blockage like a rectocele happening in real time.
So, once the case is cracked, once we know for sure whether we're dealing with software or hardware, we finally get to the resolution. And this is key. The treatment absolutely has to match the cause.
Look, this is the most crucial point. You can't fix a software bug by replacing the hard drive, and you can't fix a broken screen with a software update. It is the exact same principle here. For a functional software problem, the goal is retraining the body's coordination. But for a structural hardware problem, you have to physically repair the anatomy.
And for that software problem, the go-to treatment is incredible. Check this out. Biofeedback therapy has a success rate of over 70%. It's this amazing physical therapy that uses sensors to give you real-time feedback, basically teaching you how to consciously control muscles you never even knew you had. You are, in essence, debugging your own body's faulty code, and it really works.
Surgery, on the other hand, is only for confirmed hardware problems. These are operations designed to physically fix things like a prolapse or a rectocele, putting things back where they belong. But, and I can't stress this enough, surgery is only an option when imaging has proven, without a doubt, that a structural problem is the root cause.
And this right here is the big twist, the most important takeaway from our whole investigation. That line between software and hardware, it's not always so clear. Because if a software problem is left untreated for years, all that chronic straining puts a ton of stress on the pelvic floor. Over time, that can actually weaken and damage the tissues, causing a real physical hardware problem.
This brings us to a whole new way of thinking about what a surgeon's role is here. It's not just to operate, it's to be a master detective. Often, their most important job is to correctly identify the people who have the software problem, the ones who don't need surgery, and get them to the right therapy instead. It's a huge shift from just operating on symptoms to only operating on a precise, confirmed diagnosis. And that leaves us with one last, really powerful thought. If we understand the true root cause of the problem, software or hardware, can we step in earlier and more effectively? By catching and treating a functional disorder today with therapy, can we actually prevent it from turning into a structural problem that needs surgery down the line? All the evidence points to yes. Thanks so much for joining me for this explainer.